To understand the pathophysiology of shock, we'll first need to take a look a little bit closer at what's going on at the cellular level. So let's go ahead and draw out this blood vessel right here. And this blood vessel is going to be delivering oxygen and nutrients through the blood to different tissues. And so here I'm drawing some tissues. In fact, these little boxes I'm drawing are going to be cells, and they represent different tissues and organs of the body. Now in shock, remember that the major issue is tissue perfusion. Tissues aren't getting enough blood, the required blood that they need for oxygenation. And without oxygen, they can't create the energy necessary to sustain cellular function. So these cells right here, they're desperate for oxygen. Now there are two scenarios that we can see in shock. In the first scenario, cells are starved, and there's little blood being distributed throughout the system, and so more oxygen is taken from the blood than normal. It's not really an active process, but because there is so little oxygen in the cells, more oxygen can be pulled from the blood. This results in lower overall oxygen returning to the heart. And this can really happen in different shocks, such as cardiogenic shock, where the heart itself is not pumping effectively, so there's low blood flow. Or it can happen in hypovolemic shock, when there's hypovolemic, meaning there's low blood volume, so less blood overall is able to get to the cells. So in essence, this first scenario, there's increased extraction from the tissues due to inadequate oxygen delivery. Now second, let's take another look. What if, for example, these cells are still desperate for oxygen, but what if oxygen has a difficult time getting to these cells? This is actually what happens in the type of shock known as distributive shock. Oxygen can't be distributed from the blood vessels to cells of the body, to the tissues. So for example, in septic shock, when there's a lot of inflammation and swelling outside of the cells, or in anaphylactic shock, when there's a lot of swelling as well, there's extra fluid around the cells. And this extra fluid kind of creates a diffusion barrier, meaning that oxygen has a difficult time diffusing or traversing through this fluid and getting to the tissues that need oxygen. So this prevents oxygen from getting to the tissues, and that means that oxygen really just stays in the blood. So when the blood returns to the heart, it will have a higher oxygen level than normal. Now it would make sense to really categorize and figure out what type of shock a patient has. This is a good measurement. If we can figure out how much oxygen is being extracted from the tissues, we can have a better idea of what type of shock it may be. So how do we measure that? Well, that's where something called mixed venous oxygen saturation comes from. So that's abbreviated MVO2, mixed venous oxygen. Now what is that? What is mixed venous oxygen? So it's really hard for us to measure how much oxygen is getting pulled from the tissues at each individual tissue. So what we do is we can look at the right side of the heart. So, over here I've got drawn a heart, and you can see that blood returns to the right side of the heart through the superior vena cava. So that's this right here, the superior vena cava, and from the inferior vena cava. So this is really how blood returns from the top side of the body, from the arms and the head, and from the bottom side of the body, from the legs, organs, so on and so forth. So when blood from both the superior and the inferior vena cava meet in the right atrium, the oxygen of those two major veins mix. So before they mix, they may be different levels. So for example, we may have only 10 millimeters of mercury coming from the upper part of the body, and 20 millimeters of mercury coming from the lower part of the body. And so when these mix, we get kind of an average of the total blood from both the upper and the lower part of the body. And so going back to our little blood vessel here, if oxygen can be pulled from the vessels to the tissues effectively, like in, as we said, cardiogenic shock or hypovolemic shock, then the mixed venous oxygen will be lower in the right atrium, because more oxygen has already been pulled from the blood vessels, and therefore less oxygen can return to the heart. Conversely, if it's distributive shock, oxygen does not effectively get pulled from the blood vessels. It doesn't get to the tissues, and so it remains in the blood vessels, and therefore will have a higher mixed venous oxygen content when we measure it in the right atrium. So again, looking at this is really just to figure out what kind of shock you may be dealing with. Now let's look a little closer at what is happening microscopically. What is happening to the cells? So initially they're not receiving enough oxygen, and the oxygen they need is for energy. Normally, oxygen is used in a biochemical process called aerobic metabolism. It's the use of oxygen to create energy. However, in the absence of oxygen, the cell still needs to try to create energy, and it does this through another process called anaerobic metabolism. So that's creating energy without oxygen. Now, unfortunately, anaerobic metabolism is not quite as efficient as aerobic metabolism. So without oxygen, we're still not able to meet the energy needs of the cells. Now, initially, what happens in shock is the cells start going through this anaerobic metabolism, producing energy without oxygen. And so a byproduct of this anaerobic metabolism is lactic acid. It's a molecule that's created through this process of anaerobic metabolism. So when a cell is starved of oxygen, when tissues are starved of oxygen, you can see the lactic acid levels rise. And this can cause some problems too. As the pH of the body becomes more acidic, so pH is lower, the body has to try to compensate. And it can do this through heavy breathing to try to expel off CO2 in an attempt to get rid of all this acid that accumulates. So this is the initial stage when shock is reversible. However, as it progresses and the body continues to be starved of oxygen, the entire process becomes irreversible. And there's irreversible damage to different cells, such as the kidneys, the liver, the lungs, and that's when shock is dangerous.